Got data from about half the global population of Indigenous and tribal peoples, biggest study ever of its kind. 28 Indigenous populations, 23 countries. It's the most comprehensive picture of Indigenous health ever to date. The project was commissioned by the Lancet and the Lowitja Institute. The Lancet is one of the leading global medical journals. It shows global leadership. The Lancet has actually taken this initiative and also shows Indigenous leadership that the Lowitja Institute has led from here in Australia. It should be a wake-up call to most governments across the world. In India, for the first time, we have comprehensive data on scheduled tribes, never before published. That is just a game changer. But it's also a game changer when it comes to wealthy countries, because the size of the gap doesn't change with wealth. We've got very poor Indigenous peoples in very wealthy countries. There is a standout that comes out of the report. We know that health is generally, not always, but generally poorer for Indigenous peoples across the globe, but we know there are big gaps in data, and the gaps leave unanswered questions. And the gaps are larger in data, the poorer the country is. So there needs to be a real effort to assist poorer countries to develop the sort of government data systems that enables them to monitor the health of their Indigenous peoples. Now, there are other things that come with global collaborations. Not only do we get to work on projects such as this, but we also get to learn from each other. We learn what's happening in our countries, what sort of success stories. We learn from each other's failures. And so building those sort of global networks is one way to accelerate change. Indigenous and tribal peoples are part of the global human story. We have so much to contribute. We have so much to contribute in terms of our history and culture. Not only is it a moral issue and an ethical issue, but it is also an issue about the benefit we bring to humanity.